Hello, everyone. It's Thursday, December 23rd. Tomorrow's Christmas Eve. I caution everyone on Christmas Eve to be careful in their driving, especially, but be careful in every aspect. I'll get to offering up a tremendous Merry Christmas to all. We just finished our day of prayer. I thought it was just terrific. We're joined by ministers and priests and rabbis and just so many that offered up their kindness and their goodness in prayer. And because at the end of the day, how I feel is without question, I feel moved and have the abilities to be able to move forward only because of God above's blessings to give me the wisdom and the courage and the guidance and to be able to try to get us through this as best we can. So a wonderful day of prayer, and I thank all those that, whether they be the Cabell Midland folks or the Cameron Elementary folks or, a young child and everything. I think I'm not sure of his first name. Was it Wyatt Blankenship? But his dad played basketball for me a long, long time ago, and a wonderful family. So many people, from Parkersburg South to Parkersburg High School, and just a really special day. So, like I said before, a time of year, a holiday, the birth of Jesus Christ is so I don't know of how it could be any more important. It's a time of year of reflection on all those that we've lost, and I'm going to read you another additional 40 great West Virginians. We've lost 5,251 people in West Virginia. And please remember all these families. I mean, at this time of year, we'll have a lot of smiles and laughs, but these families are hurting. And please remember them. Remember all those that are hungry, all those that we need to be able to try to continue to help in every way. And we're trying to reach out a hand to every way that we possibly can, and we're going to continue to do that until we've flipped every rock and we've tried to help everyone. But nevertheless, our 5,212th death is a 59-year-old male from Ohio County. Our 5,213th death, a 59-year-old male from Fayette County. Our 5,214th death, a 37-year-old male from Ohio County. Our 5,215th death, a 74-year-old female from Mason County. The 5,216th death, a 92-year-old male from Kanawha County. The 5,217th death, a 52-year-old female from Mingo County. The 5,218th death, a 58-year-old female from Summers County. The 5,219th death, a 60-year-old female from Marion County. The 5,220th death, a 40-year-old male from Doddridge County. The 5,221st death, an 86-year-old male from Jefferson County. The 5,222nd death, a 77-year-old female from Harrison County. The 5,223rd death, a 53-year-old male from Brooke County. The 5,224th death, a 68-year-old male from Kanawha County. The 5,225th death, a 51-year-old male from Ohio County. The 5,222nd death, a 79-year-old male from Jackson County. The 5,227th death, a 65-year-old male from Marshall County. The 5,228th death, a 28-year-old male, good gracious, a 28-year-old male from Harrison County. The 5,229th death, a 75-year-old female from Monongahela County. The 5,230th death, a 91-year-old female from Fayette County. The 5,231st death, a 40-year-old female from Preston County. The 5,232nd death, an 82-year-old female from Raleigh County. The 5,233rd death, a 70-year-old male from Morgan County. The 5,234th death, a 54-year-old male from Nicholas County. The 5,235th death, a 67-year-old male from Kanawha County. The 5,236th death, a 44-year-old male from Barber County. The 5,237th death, a 61-year-old male from Mercer County. the 5,238th death, an 86-year-old male from Hardy County. The 5,239th death, a 72-year-old male from Lewis County. The 5,240th death, a 64-year-old male from Logan County. The 5,241st death, a 73-year-old male from Mineral County. The 5,242nd death, a 60-year-old male from Wood County. The 5,243rd death, a 66-year-old female from Cabell County. The 5,244th death, a 47-year-old female from Grant County. The 5,245th death, an 86-year-old male from Jackson County. The 5,246th death, an 88-year-old male from Hancock County. The 5,247th death, an 87-year-old female from Grant County. The 5,248th death, a 69-year-old female from Logan County. The 5,249th death, a 77-year-old female from Greenbrier County. The 5,250th death, a 73-year-old female from Kanawha County. And the 5,251st death, an 80-year-old male from Cabell County. Active cases, 9,285. New positive cases, 1,495. Daily positivity rate at 10.93, 6.39 cumulative. We had 304,000 plus people that have recovered. We have 580 hospitalized. That's down just a teeny bit. We have 203 people in the ICU unit and 103 that are on ventilators. We have 86% of the people that are in the ICU units or on ventilators are unvaccinated now. We have 5 green counties, 19 red counties, 22 school outbreaks in 15 counties with 272 people that are confirmed. I think, well, I'll just keep going, I'm sorry. I always remind you, if you're 65 and older or 50 and older, whatever it may be, you've got any kind of conditions whatsoever that, and you're going into a crowd of people indoors, you probably ought to really think really hard about wearing a mask. You know, if you've got any lung or heart or diabetes or anything like that, especially, you ought to really think about that. I remind you over and over about getting tested about the antibodies. If we can get them to you early enough, it'll save your life. I encourage people, again, you know, about wearing your face coverings and absolutely, if you have any condition whatsoever that comes up where you have what I call a sniffle, or you are feeling just, you know, unusually tired or whatever, go get tested. Please just go get tested. It's free, and absolutely it can save your life as well. I talk over and over and over about the booster shots. All the medical community, all the experts in the world tell us just how important those booster shots are. And absolutely, if you're vaccinated and you think, well, I'm in good shape, I'm fully vaccinated, I got 2 shots, and I got those 7 months, 8 months ago, you know, you're really making a bad mistake. A very foolish mistake, because your immunity now is either worn off completely or it is so low it's unbelievable. And with this Omicron variant and, you know, and the Delta with the Omicron variant and the Delta variant that are out there and COVID and everything, it is absolutely likely that if you are absolutely get to the point in time where your vaccinations are so far away without the booster, you are putting yourself in harm's way like you can't imagine. And so I tell people all the time, I say just this, and I mean it. It's the day before Christmas Eve. I know everybody is scurrying around, you know, buying gifts and doing all that and everything. There is nothing as important as to you right this minute, and I mean nothing, that's as important to you as getting your booster shot if you're 6 months out from getting 2 vaccines from Pfizer or Moderna, or you're 2 months out from getting your vaccine on J&J. Absolutely, without any question, you cannot absolutely not do that. You have got to get that booster shot right now. The numbers haven't changed much, but we continue to get more and more and more people across the finish line with the first doses and everything. We're at 71% of all the 18 and above. We're at 83% of the 50 and above. We're 91% of the 65 and above. We just got to keep at it, keep working it. From the standpoint of all the stuff about Do It for Baby Dogs Senior Center Edition, you know, I've told you many, many times, I think that this is exactly what we should, you know, that you should be thinking about. If you are fully vaccinated and you will just register, you'll get a $50 gift card absolutely immediately. Now, in addition to that, by being fully vaccinated and registering, which will take 10 seconds, and I'm exaggerating to make my point, it's nothing to do. But to be fully vaccinated and register, you are absolutely helping your senior center qualify for one of the $100,000 awards, and there's going to be 4 of them that are going to go out, and $100,000 to a senior center is big, big, big time. So do that, and it's open until December the 27th, and then that'll close. I remind all of our young people, we really want you to get you vaccinated, but from the standpoint of our grandparents and our parents, please help us to get those kids vaccinated. You don't know what the lingering side effects can be, and the vaccinations have been proven to be incredibly safe. Get them vaccinated. It's really important. From the standpoint of the COVID vaccine line, it's up there on our website. You don't need me to talk about that. You don't need me to talk about getting the testing is all free. And I thank Frith and I thank Walgreens as I have. They've been great partners in this. I encourage you to give blood. We absolutely have a blood shortage right now, and especially if you've had the blessing of recovery from this terrible pandemic and you're doing okay, consider it. You have been blessed from God above on your recovery. Consider giving blood. It's really, really, really important. 44 outbreaks in our long-term care facilities now, and West Virginia has no outbreaks in our church community. Way to go. That's terrific news. 66 inmates and 44 staff cases. That's awful good work from corrections. I remind you about the flu vaccine. You can get it at the same time you get the COVID vaccine. And I tell you over and over about the rental assistance program. This program is for renters, but it is also for landlords. And we still have a good bit of money in that bucket and everything that we could get to you and everything if you can qualify. But absolutely, there's no way to know if you can qualify or not if you don't take the time to call us. And all the information is right there. Please take the time to call us. Now, the last thing I've got, and I could have led off with this and everything, is I promised you, a breakdown on the $122 million of CARES dollars that we still have. And here I go. I'm going to go through it pretty quickly. You can get more and more detail from our office and everything. We'll be putting out a whole lot more, information about this. But here, here's how we've decided to put those monies in buckets that can better help West Virginia in every single way. We've tried to spread this out all across our state. I think we've done so, but I'm going to go through it. I'm going to go through it as quickly as I possibly can. But like I said, as you have questions and everything, please, inquire, and we'll get you all the information about every one of these. You've heard about our nursing program to bring more and more quality nurses to the state of West Virginia. $48 million there. We said the other day, and I can't believe it, but we had 1,700 nurses in the state of West Virginia not renew their license last year. Now, if we lost 1,700, 68% of those said the reason they didn't do it, they were worn out. They couldn't take it anymore. They just couldn't take it anymore. Absolutely just worn out. Now, with all of that, we've got a real critical problem there, do we not? So what we're doing is we're amping up our nursing programs all across our state, and adding additional, schools and institutions for us to produce more and more and more quality nurses. That program recruits nurses from other states here right now. So it is absolutely a novel and great program of a need that we really have. In addition to all that, like I've said over and over and over, it supplies multiplier effects of additional dollars going into our state, and as we continue to pump out nurses and nurses and nurses across our state, more and more and more multiplier effect of those dollars happens. So we're really proud of that. We're going to do a back to work initiative. This initiative is a $22 million initiative, and we're doing it with workforce, and there's more details on that that'll come, but really primarily what this is to bring additional people that are still not in the workforce back to the workforce. The only way we're going to allow you to do this in this incentive program for this is you have got to get a job, and you have got to have that job for in excess of 90 days. And then you have the option of earning an incentive, but because we now have an unemployment rate that is really, really low, but we still have a bunch of folks that are still at home. And if we can help them with an all-encompassing type program where we can help them with the possibility of daycare, whatever it may be, to get them back into the workforce, to absolutely get them on a pathway of feeling great about themselves and everything and their accomplishments. We always feel a real pride as we feel accomplishment and everything. And the bottom line is, without any question, our economy needs those people. Absolutely, without any question, we are begging for more and more and more people to be in the workforce. So I think this initiative will really be beneficial. We're going to put $10 million into an emergency management crisis fund. This is to go to our first responders, the people that we felt like were absolute, without any question, true heroes all through all this. All the different folks from local emergency management to right on down, will be involved in this and everything. You'll hear more detail as we roll all that out. We still got hungry people across West Virginia. That's all there is to it. We're going to put another $7.25 million into our food pantries and homeless shelters across the state of West Virginia. $3 million of it will go into our food banks. With $2 million of it will go into facing hunger and the Mountaineer Food Bank. Then there'll be additional dollars that will go into the upgrades and everything of our Rock Branch facility that the National Guard works on, from the standpoint of being able to administer more food and do more good stuff there. We will be purchasing a larger scale combination cooler and freezer that will allow us to give proper cold storage there at that site. We will be giving $250,000 each to the following organizations: the Union Mission in Charleston, the Clarksburg Mission in Clarksburg, the Huntington City Mission in Huntington, the Martinsburg Union Rescue Mission in Martinsburg, and the Bluefield Union Mission in Bluefield. Also, the Union Mission of Fairmont, that is West Virginia Rescue Ministries in Fairmont, and the Faith Mission Homeless Shelter in Hurricane. We will rebuild the Salvation Army in Beckley. The Salvation Army building in Beckley is absolutely just completely gone. We will be giving $6 million to this organization, to the Salvation Army Potomac Division, serving Raleigh, Wyoming, Fayette, Greenbrier, Nicholas, Webster, and Pocahontas counties. It will be used to help them expand their programs and provide services to all West Virginians in need in those areas. Shepherd University is on the cutting edge of doing some really, really neat stuff. with light therapy. We're going to give them $500,000, and that is to develop this cutting edge technique that manages pain and does so many different things that could very well be a breakthrough in the COVID situation as well. We're going to do $3 million to our remote work facilities. This money will go to WVU to expand remote work facilities across the state. We're going to make the proper upgrades at our state fair. State fair facility in Lewisburg absolutely along the way has helped us and established themselves as basically a COVID center in many different ways. The West Virginia building there is falling down and got all kinds of issues and everything that needs the proper upgrades to ensure us to have that facility for years and years to come. Game Changers is doing good stuff in the state of West Virginia. Game Changers is working on drug prevention and with our young kids and everything. You know, together with communities and schools and jobs and hopes, there's so many good things going on where people are really stepping up and making a difference in our children. So we're giving Game Changers $2 million as they move forward in this. And they continue in a student-powered substance misuse promotion, and they have done some great work, and we're going to continue to support and partner. I'm honored to be their head coach, but within all of that, I can never say enough. I can never say enough of the accomplishments of the Jobs and Hope program that started out as Jim's dream. Without any question, if you'll just step back and be really fair and you'll go to the schools, you will not believe what communities and schools are doing. Absolutely, it's tens and tens and tens of thousands of students now. And the work of the site coordinators and what they're doing in those schools is unflat believable. All you got to do is go and see what is happening out there in our schools. It's good stuff, good stuff. We got $2.7 million in pandemic-related costs in our DHHR, you know, such as testing and vaccine distribution. You know, from the standpoint of the Do It for Baby Dog sweepstakes, $1.3 million is going, you know, in additional funds in that. There's $3.3 million in accounting and pre-taxes where we have prepaid taxes on gifts that we've given to folks. And the last but not least thing is that leaves a total balance of $15.2 million. We're going to put that entire $15.2 million in a deep dive situation back into our agencies. If you'll remember along the way, we gave $265 million that went to the counties and the cities across the state of West Virginia. And this basically is the assurance of a cleanup, you know, that these agencies have expended lots and lots of dollars that we've absorbed in the state. And this is, we could go back and we could deep dive and we could have put back into these agencies well over $100 million. We don't see a need to do that. But by doing this, we will absolutely assure ourselves that if we have any additional expenses that come to us that we have not labeled today, that these agencies will be able to fund those expenses without diving in and having to do an additional burden on them. But basically, this cleanup, this last cleanup, will ensure us that we have run the store to the finish line and run the store in a proper way and not got caught with a bill of $10 million or $12 million that we have not forecasted at this moment. So with all that, that's it, and that should wrap up the balance of the CARES money. And like I said, I continue to be able to report to you that West Virginia is doing the right stuff. We're moving forward as we continue to produce those surpluses. More and more people are wanting to come here, and so that's good stuff. That's all I got.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Several items this morning to highlight, reinforce points that the governor made while we continue to make progress on our boosters. And we today reached 50% of our over 65 population has now, who is eligible, has now received a booster. We're still only at 44.1% for over 50 population. So as we have mentioned, boosters, and as the governor continues to mention, boosters are key to our success, particularly with the new variant coming forward. So we've got to continue to press our friends and neighbors, everyone, to get that booster dose. We have also hit 70.8% of the population over the age 18 who has now received a first dose, and that continues to move up, steady but slow, as with our booster doses. So we've got to continue to pick up the pace on that. But the good news is almost 71% of West Virginians over the age of 18 have decided that the vaccine is important to get. So positive signs in those areas. As the governor pointed out, we have significant concerns about blood shortages during the holiday months normally. Now with the additional variants and the stress on our hospitals, a lot of concern about that. Please consider giving blood. The Red Cross is also struggling, as are other organizations, with staffing. So there may be some delays as you go to give blood, or you may have to be rescheduled on an appointment day based on availability of opportunities with staff. Please be patient and continue to press to give blood. One of the things that we are doing at the governor's direction, we are working with the Red Cross, and both the National Guard and VOAD will be working to potentially provide staffing support and relief going forward, as well as some potential folks within the DHHR system. As the governor pointed out, hospitalizations continue to be in the high range, and we continue to have a significant portion of those in the hospital, in ICU, and on ventilators. And once again today, we surpassed that threshold that we try to stay below of 60 admissions. Today's admissions number was 68. And as the governor pointed out, most all of the people in the ICU and on ventilators, 87% and 86% respectively, are unvaccinated West Virginians. The concern that we have and the hospitals have going forward, we only have 3 primary locations in the state: Morgantown, Charleston, Huntington, where we have those primary hospital hubs such as Ruby, the CAMC, Mountain Health, and then also in Morgantown, we have the Mon Health team. Our critical access hospitals will get backed up with patients because those hospitals, those main hospitals, fill up with COVID patients, and it is going to impact other West Virginians' care. Somebody at a critical access hospital who needs to be moved to another hospital for more aggressive heart surgery, things of those natures. So we've got to continue to press to get vaccinated. I also want to highlight that we did receive word just a little bit ago from the U.S. Department of Health and Human Services that they will be slowing down some of the antibody therapies being moved to the states because those antibody therapies are not useful in the treatment against the Omicron variant. Right now, we still continue to have the Delta variant as our primary threat, so we will continue to work with them on addressing those issues. The other thing that has come out nationally is the Paxlovid and that medication that can potentially be used, as well as they just in the last couple of hours approved another medication. Want to make sure that all West Virginians understand it is a medication. It is not available in significant supplies. In some cases, the Paxlovid, for example, takes several months to actually manufacture the components and the doses for that. We next week will receive approximately 300 doses of that. But the issue is, and I'm going to turn it over to Dr. Marsh and Dr. Amjad as I leave you with this, is that there are a number of medical conditions and a number of medications that individuals take, or the medical conditions they may have, that are going to prohibit a significant number of people from using this particular medication. So with that, Dr. Marsh, Dr. Amjad, I'll turn it over to you to provide more details on that and the concerns that we have that this is not going to be a significant benefit to us initially, and that vaccines are still the most important opportunity we have.
Thank you, sir. We'll now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. It's great to be with everybody before the holiday season, and our main concern, as always, is to make sure that we recommend the pathway related to COVID-19 that allows our population to stay healthy and to support our hospital futures. Ultimately, what we know is that the Omicron variant has become the dominant variant in this country and happened over 3 weeks. We know that in some places in the U.S., it's 90% of the new cases. And we also know that yesterday we saw almost 250,000 new cases of COVID-19. And remember, the single day high is right around 300,000 for the entirety of the pandemic. It's been estimated that we may see as much as 500,000 to 1 million new cases a day unless we act very robustly to try to reduce the threat of the Omicron variant of COVID-19. Now, one of the benefits West Virginia has had for the entirety of this pandemic is we get a chance to look out at what's happening in other places that are more populated, that have bigger centers of interaction, to understand what's coming to West Virginia. And what we know is that hospitals are being stretched across the United States and across the world, not only with the Omicron variant's impact, but with the Delta variant's impact, with influenza, and certainly also with the Omicron variant of COVID-19. As we look forward, we know that people that are unvaccinated have a 10 times risk of getting infected with COVID-19 and a 20 times risk of dying. And as you get older, that risk amplifies more and more and more. In fact, in Israel, as they look at their own data, they have been one of the leading places in the world that's pushed booster doses of the vaccine, and they are now starting to approve for people over 60 years old in Israel another booster, the fourth dose. They are mostly a Pfizer country, and they're looking at pushing the fourth dose of Pfizer for people over 60 years old, because they have found that after 4 months, the risk of getting reinfected in that population is 3 times higher. So as we look at our own numbers, we know that our own booster rates in people that are eligible is only about 32, 33%. And even in our most highly susceptible group, our over 65-year-old group, it's about 50%. We have to do better. That is the primary protection from COVID-19, hospitalization, death, severe disease. General Hoyer pointed out that we now have gotten word from the FDA that we will have access initially to the Pfizer drug, which is Paxlovid, which is a drug that affects some critical enzymes in the virus and works with the Omicron variant, works with the Delta variant, and seems to reduce the risk of hospitalization by 90% when given within the first 5 days of symptoms, which is why it's so important to test, and is approved for West Virginians and Americans over 12 years old who test positive, who have significant risk of having severe complications of COVID infection. And as General Hoyer said, initially it will be in West Virginia in very, very limited quantities, and it's a complicated medicine that interacts with other medications, so there's going to be some restrictions involved as well. Soon after, we will have access to the Merck drug, molnupiravir, which works differently. It works to induce genetic changes in the virus, which reduces the ability of the virus to multiply and replicate. Really important for both of those drugs. If you do get prescribed the drugs, you need to take the entire drug prescription, because particularly with the Merck drug, the molnupiravir, it's potential that if we give the drug and people don't finish it, it could accelerate mutation of the virus. So really important to take both. Now in West Virginia, we are finishing today our next genetic sequencing run, and it looks like still that we don't have a predominant number of Omicron cases. We still see a lot of Delta variant of COVID-19 in West Virginia, which, as General Hoyer said, is good news because, one, the Omicron variant is so infectious, but two, some of the antibodies that may not be as effective against Omicron that is being seen in other states still is very effective against Delta, and we hope that we can get access to that to help people here. So the bottom line going into the holiday season, number one, get vaccinated, absolutely critical. Get boosted if you haven't been boosted, absolutely critical. If you are older and you either haven't been boosted or haven't been vaccinated, please be very careful about who you interact with, where you go. It's time to upgrade your face mask. The surgical 3-ply mask or an N95 or a KN95 mask that you can order online now that's approved by NIOSH, National Institutes of Occupational Safety and Health. Really, really important. And if you test positive and you're at risk of being hospitalized, over 65, other medical conditions, please contact your health provider to see about getting monoclonal antibodies, or if the pills become available, whether you would be a candidate for that. Have a safe and happy holiday. It's a really important time for us to really focus on being thankful for our gifts, but also protecting ourselves, our communities, our families, our hospitals, and the state of West Virginia during this very sacred time. Thank you.
Thank you, Dr. Marsh. Next to Dr. Ayn Amjad, our State Health Officer.
Good morning. Just want to add, to addition to what Dr. Marsh said, that testing is very important. And so as part of our commitment to keep school-age children, teachers, and staff safe from the winter break holidays, we are going to be having testing sites at some school locations. We're working on all that right now, and we'll push out that information. But it's optional, it'll be free, and we encourage anyone to take advantage of this and to just remind everyone that our testing sites are still on our DHHR website. Thank you.
Thank you, Doctor. Next is Secretary Bill Crouch with the DHHR.
Good morning. In the midst of the holiday season, I want to remind everyone of some great state resources that we have available to help those that may be feeling a little stressed or overwhelmed. The COVID-19 pandemic has had a major impact on most of us. It has continued going on, getting close to 2 years now. Many of us are facing challenges that can be stressful, overwhelming, and cause strong emotions in both adults and children. So if you are experiencing stress that gets in the way of your daily life, please talk to your healthcare provider. Mental health services can be very beneficial. I encourage you to reach out for help if you need help. We recommend the following helplines. I think Jordan's going to put those up on the screen. These helplines are available and open 24/7, 365 days a year by phone, text, or online chat. Accessing these resources using the method that you find most comfortable and practical can be very beneficial. Please do not delay in reaching out if you or someone you love needs help. With the West Virginia hospital system already overwhelmed due to the COVID-19 pandemic and the emerging flu season, we need to reserve our hospitals to serve those that are critically ill. The Children's Crisis and Referral Line is a critically important resource for mental health, mental well-being, and safety of the West Virginia children and families. So please check in on those that may need your help, friends, family members, and as the governor says, that every please get vaccinated. And those of you that have been vaccinated, please get your booster. I want to wish everyone a Merry Christmas, especially the employees of DHHR who have continued to make sure that things move as smoothly as possible through this pandemic. Their hard work is very appreciated. So Merry Christmas to everyone. Thank you.
Thank you, Secretary. We'll now go to questions from members of the media. The first today from John Mark Shaver with WV News.
Good morning, everyone, and Merry Christmas. I have a question for Dr. Marsh. The British Medical Journal released a study about COVID-19, and in particular, it highlighted the dangers to the elderly population, including those who have even received all three of their shots. So I was hoping, if you have had a chance to look at that study, if you could comment on it, and even though it was done in the UK, talk about how that applies to us and our elderly population. Thank you.
Thank you, Governor, and thank you, John Mark. This is an important study from the standpoint of re-emphasizing many of the points that we make virtually every press briefing. And that is that we know that the most vulnerable part of our population are our elders. West Virginia is the third oldest state in the country. And as a reminder, Kaiser Families rated us going into this pandemic as the most vulnerable related to chronic health problems. The article that John Mark is referencing suggests that elderly patients have about a 1 in 220 risk of dying of COVID-19, even when fully vaccinated. And that compares to a 5 times to 10 times risk of people that are not vaccinated. Remember, we talked about the risk of getting COVID-19 is 10 times greater for unvaccinated versus vaccinated and boosted people, as well as 20 times risk of dying for unvaccinated versus fully vaccinated and boosted West Virginians and Americans. And this rate, although very high, is what we also see in people from the flu in many years who are elders who have not gotten the flu vaccine. So it also reminds us it's so important for us to get flu vaccines into all West Virginians as well. And it also underscores the importance of getting boosted. We know that our residents of our long-term care facilities and people that are older make up the brunt, the majority of people that have died of COVID-19 in the U.S. Now, well over 800,000 people have died in the U.S. And we know that ultimately, if we do not continue to work on vaccinations and boosters, we will see even more West Virginians die and be hospitalized. Remember, 3/4 of all Americans who've died of COVID-19 have been over 65 years old, and that means 1 out of every 100 people who have died of COVID-19 has been over 65 years old. So for all of the elders in West Virginia and all of us, it is so important for us to get vaccinated, to get boosted, to be very careful, and to enjoy a safe holiday season with your family. But this is a time not to take unnecessary risk and to protect ourselves. Thank you.
All right, thank you, John Mark. Next to Bob Aaron with WCHS and Fox 11.
I notice we're strongly recommending masking, social distancing, avoiding large crowds for people over 65 or with health concerns, but why not that for everybody?
Maybe, Doc, you want to go again, or Dr. Amjad?
Either one's fine. Let me go?
Go ahead, please.
Okay. Thank you, Bob, and thank you, Governor. So we would absolutely recommend that everybody who is eligible, please get vaccinated, and that includes our younger West Virginians, because we know that these young folks are susceptible to infection with the Delta variant as well as the Omicron variant. and can pass it to other more susceptible members of our community. And we also know that long COVID, persistent symptoms of COVID, can negatively impact our children. So we do recommend, in addition to full vaccination and boosters for those that are eligible, that every West Virginian take a lot of caution and planning for this holiday season to be able to practice those good mitigation strategies that include good hand washing, physical distancing, face mask wearing, particularly when you're around people that you don't live with all the time, and consider upgrading your face mask. Because ultimately, even though we have not seen a predominant of COVID-19 be Omicron yet, it is just a matter of time, and we will. And this holiday season is a really critical one for our hospital system, and we don't want the governor to have to continue to read names of good West Virginians who've died of COVID-19, which today is a preventable form of death if people do the right things, get fully vaccinated, and pay attention. And it will also reduce our risk of having negative outcomes from the flu as well, as we saw last holiday season. Thank you.
Thank you, Bob. Next, we'll go to Aaron Noon with Next Star Media.
Hi, everyone. Merry Christmas. I had the opportunity to speak with the West Virginia Nurses Association yesterday, just asking them about the, announcement of the $48 million in the CARES Act going towards expanding education. And they had said that that is great and they're super happy about that. But I guess they were questioning where some of the funding would go, because they kind of need help now with being understaffed and just, like for paid time off, or just for the people who are on the front lines right now. So I was wondering if anybody could maybe comment on that, or if they're going to get any kind of funding to help their situation right now. And then a follow-up to that would just be, is anybody concerned about the holiday season and hospitals becoming even more overwhelmed, because it's not just a West Virginia problem, it's a nationwide problem of understaffed hospitals. So what are we going to do to kind of combat that? Thanks so much.
Aaron, listen, thank you so much and everything. And Bill, maybe you could you add something to this, Bill? And and from a standpoint of, maybe something that you would forget is we do have our Save Our Care that we initiated early on to really protect and look after our hospitals and everything. But nevertheless, if you'd add something to this, please.
Yes, sir, Governor. We have discussions every day that cover a broad range of issues in this pandemic, and the governor constantly brings us back to the issue of staffing and trying to help our hospital staff. We have nurses who are exhausted. I actually had a conversation with a nurse late last night from a hospital who reached out and was asking some of the questions you're asking, Aaron. So we have pushed out a great deal of funding, $58 million to hospitals through the Save Our Care program, which the governor asked us to do and do quickly. And we're still looking at the staffing issue. We're all competing against the same staff. We're competing against nursing homes. Nursing homes are competing against hospitals. Our state facilities are competing with hospitals and nursing homes, and we're competing with other states and out of state entities that may be paying more than we're paying. So it's a difficult situation. We've looked at trying to bring students out of schools quicker to provide assistance. We're pushing some National Guard out who are not clinical people. People don't always understand that if we bring clinical people back into the Guard, they're coming from hospitals back into the Guard. So we don't want to deplete the folks that are out there now. So we're looking at trying to do some things with regard to nurses who have retired early, trying to see if we can bring them back. Working with hospitals on incentive programs and ways to retain nurses that they have now. So this is a difficult situation. We talked early on about the problem in this pandemic early on was beds and availability of beds. We have beds. The problem is the availability of staff, and we're working hard on that. So thank you for the question. We've not forgotten the staff out there, and we appreciate what they do every day. They absolutely run to the fire every day, and we thank them.
Thanks, Aaron. Governor, I'll turn it back to you.
Well, in wrapping up, this is the last time we'll be in front of you before Christmas. Tomorrow's Christmas Eve, the day after Christmas, the birth of Jesus Christ. It's unbelievable. What a holiday. There's 5,251 families across this state that have now lost loved ones. And there'll be more by Christmas. I ask for your prayers for all of them, in every single way, that they do not feel alone. Absolutely. I ask you, if you know any of those folks, to reach out to them, offer a kind hand, offer anything. Absolutely, without any question. It's a tough time of year for everyone that has been involved in this terrible pandemic. A tough time of year for all West Virginians in lots and lots of ways. I know our kids are tired of wearing masks and so many different things that are going on. But we're going to get through this. But I'll promise you, the way we get through this is one path, and one path alone. And that is West Virginians absolutely continue to pull the rope that God has given us. God has given us that rope, and continue to pull the rope together. To not look at one person or the other and say, no, I don't like you, and I have, your views are so, different than mine that I don't want anything to do with you and everything else. Be respectful. Be respectful of just all. And love everyone. I say it over and over and over about that little bulldog that I got with me a lot. If you'll just think about what she does, she makes everybody smile. I've said it so many times. She makes everybody smile. It's a gift, is it not? A real gift. And you know what she also does? I've never run into a single person, adult, kid, or whatever it may be, that she doesn't love. Now, could there be a better message than right now, Christmas? If we had the ability to some way, somehow, make others smile, and we had the ability to absolutely, whatever we do, love everybody. That's really what our message should really be. It came from a little English bulldog that grew into a pretty good sized English bulldog. But really and truly, if there's a message out there better than that, I'd love to hear it. So with all that, I leave you with just this. I promise you we'll get through this. I promise you that we'll get through this so much better if we stay together. And I promise you just this. The merriest of all Christmases to all of you. My wish, Kathy's wish, all my family's wish to all of you is just that. The merriest of all Christmases to you, West Virginians. You are the best. I've known it for a long, long time. I knew it when this hair was really a little bit still brown, but I've known it for a long time. You are the best of the best. I couldn't be more proud to be your governor, and we're just going to keep on keeping on, and we're going to keep on showing the world just how great we really are. God bless each and every one of you. Merry Christmas, West Virginia.